that Britain is, or London rather, at that time was already a very multicultural city. But if you looked at the patient population in the adult department, they were almost entirely white. And those things really were a bit of a culture shock to me. Anyhow, by 1988, I was coming to the end of my 4 years in the department, and the adult department, together with Nafsiyat and Roland Littlewood's unit in medical anthropology at UCL, put on a joint series of seminars on, I think, over 4 Saturday mornings. Um, and the whole point of that was to try and consider this problem that had begun to puzzle me, why there were not more persons of color who made it as patients, and why the staff grouping seemed so. It's not the color, but it's lack of awareness of racism. And when they thought about racism, they somehow thought that it wasn't a psychological problem. It was a political thing. It was sort of outside. And the whole attitude was to reduce it to psychological components and so on. You'd know, all of you would know that kind of history of the psychological engagement, psychoanalytic engagement with race and racism. Anyhow, so at that series of seminars, that's where I first met Jafar and the team at Nafsiyat at that time. Um, and the whole point of that series of seminars was to begin to think about whether the psychotherapeutic needs of minority communities were being neglected in a profession that was largely white. So, as I said to you, I was the first person of color in the adult department, but shortly afterwards, I think in my second year, somebody was appointed to another training position, Sharon Newmer, some of you may know. And then shortly after I'd left, Narendra Kaval was appointed to a training post in that department. And shortly after that, Maxine Dennis. And all of them have gone on to become very eminent people in the field and to make important contributions. And in the adolescent department, I think short by about 98, I think before, if I'm not wrong, Frank Lowe was appointed. And many of you will know that Frank started a very influential thinking space initiative in the Tavistock, which was specifically designed to make room to think about these issues of race and cultural difference and how one takes them into account. So things were beginning to move, or moved quite quickly after that conference, that series of seminars, rather. It wasn't a conference. Original papers were presented by Roland Littlewood, and people will know Roland. Is he still involved with Nafsiat? Because he was the very first medical consultant, I think, to the team. Um, and you'd know his influential book, Aliens and Alienists, with Morris Lipsedge. So Roland presented a paper, Jaffa presented a paper. They asked for a paper from the Tavistock, and instead of one, we gave them two shorter papers. One by a colleague of mine, Sue Davison, who wrote on group work, and I wrote on work with the patient, who was very politically correct, it seemed to me. It's a patient who had a black boyfriend and was very proud of it. But she told me that her mother hates blacks, the unemployed, and Princess Margaret. And that was such an interesting observation because I understood that she had some internal racist issues, not conscious, but unconscious, which were being projected into the mother. So I wrote something about that. It's my first exploration into, how subtly race and racism can be part of the mind. So those were the people who presented papers. And each paper had two discussants. They included Nicholas Rose, Marilyn Miller Pietroni, Elaine Arnold. Many of you will remember her, very influential person in our field, Paul Vernon, mainstream BAP man, David Taylor, one of the consultants in the adult department, and Lennox Thomas. Those papers are in the Journal of Social Work Practice, 1988, Volume 3, Number 3. Now, I made a very good contact with the colleagues from Nafsiyat, and when I completed my course a few months later, Jaffa offered me a session at Nafsiyat, which I was, of course, very grateful for. And there we met weekly. Jafar was always there. I don't know if people remember Surangshu Acharya. He was a psychiatrist. Sharon Morehouse is a clinical psychologist. Chriso Andreu, child and adolescent psychotherapist. And the four or five of us were regulars every week. And from time to time, Lennox came in, and from time to time, Elaine came in to these weekly case conferences where we would present cases and do the assessments, discuss patients who've come for treatment. Now, at that time, the I think it's still a bit like that. The psychoanalytic and psychotherapy profession saw themselves as very liberal in outlook, and I think they still are, and have a professed conscious tolerance of race. They didn't discriminate between people of different races. And as Lennox said in one of his papers, it's a profession that saw itself as colorblind. And Lennox particularly criticized that because he was convinced that if you saw yourself as a mainstream white psychoanalyst, psychotherapist, if you saw yourself as colorblind, you were very likely to miss manifestations of racism. And indeed, that was what we found at Nafsiyat, that the experience of racism was something that the profession didn't see. So very often we'd have patients who'd been seen in the mainstream services and who looked untreatable and just couldn't make any progress. They were sent to Nafsiyat, and we found that the problem was that the patients, who mainly were Black, Asian, and so on, that they suffered from an experience of racism that came alive in the assessment and in the transference, and that was the problem. And we found if we made a bit of space for that and talked to patients about that, it became less of a big issue. And these patients who seemed completely inaccessible to psychotherapy suddenly begin to look a bit more normal. Do you know what I mean by normal? I mean the sort of patients that we, as the profession, would think, yeah, that person's got a psychological problem. Our kind of treatment might be able to help them. That's what I mean by normal, rather than completely inaccessible. And I thought I would give you an example of that, and I'll read you from Jaffa's chapter in this book. You all know this. This is the first book on the work of Nafsiyat that was published. So this is Jaffa writing. I received a phone call from a colleague who asked me whether I could help with a neighbor's son, John. He described the neighbors as a West Indian family who'd experienced considerable difficulties in establishing themselves in this country. The father had abandoned the family when the children were small, and the mother had to struggle very hard, first working as a cleaner in a hospital and then as a nurse. The son, John, was very intelligent, upright, slightly shy, and rather withdrawn. John had suddenly stopped going to his college classes or meeting friends socially and had locked himself up in his room. His mother hadn't been able to talk to him, and she now asked for my colleague's help. Jaffa writes, John came to see me, brought by his stepfather, but I suggested that I see him alone. He was a good-looking young man, a little nervous and solemn. I let him be for a few minutes and then told him how I'd got involved and asked him if he wanted to say anything to me. He kept quiet for some time and then mumbled something which sounded like, "You won't understand." I replied, "Of course I won't understand if you don't want to say anything to me. But since you're here, it may be worth your while just to explore and find out whether I can understand you. Maybe I will, and maybe I won't." John fidgeted in his chair, asked my permission to smoke, and when I nodded, lit his cigarette, inhaled deeply, and looked at me steadily for a few seconds. Then he told me his story. He'd always been a lonely person and mixed with a few select friends. During the final year of his studies, one of his tutors suggested that he should see somebody to talk things over, as the tutor felt he was tense and didn't appear to be concentrating, possibly because of a lack of sleep. John agreed, because there were lots of things on his mind: problems between his parents, his sister's unexpected pregnancy, his parents' reaction to this, the demands of his studies, and the pressures of his family on him to do well. Through his college, he was referred to a psychotherapist whom he saw once a week during college hours. He did well in his finals, got a good job, was now earning and able to pay, and increased the sessions to twice weekly. At this point, he became quiet again and looked vacantly into space. After some time, I commented, "And so?" John looked at me, turned away his face with a lot of anger suddenly, said, "This is what happened. One dark winter morning, I was waiting at a bus stop to go to see my therapist. There were one or two people in the queue, and as the bus was late in coming, I was feeling anxious. I started to fidget in my pocket looking for my bus pass. Suddenly, a police car drew up and two policemen jumped out and made me stand against a wall. They searched me all over. I was very angry and frightened and didn't know what was happening to me. When I questioned the policemen, one of them said I was behaving suspiciously and they wanted to check me out because they thought I had drugs on me. When I said I had a doctor's appointment and produced my student card to show I was educated, the policeman laughed at me, saying, "Oh no, you're not going to college, you're coming with us." I was absolutely staggered and in a rash moment suggested to the police they should follow me. They both burst out laughing, and one of them actually got into the bus with me, with the other following in the car. They were having a good joke at my expense. In the bus, I was sweating, wet all over, and so on. When I arrived at the therapist's store and rang the bell, the policeman was still laughing at me. However, the therapist came out and took me in. I was too overwhelmed and shocked and couldn't speak during the session. My therapist kept quiet, and the silence infuriated me. And at one point, I could not hold myself back and blurted out in an angry voice something like, "You don't understand." By this time, I was crying, but still my therapist said nothing. I could no longer contain myself and told the therapist what had happened to me on my way there. There was a silence I could not bear. Then my therapist said to me, "You are expressing this anger because I am white." I was stunned. because until that moment it had not mattered to me that the therapist was white. And when he said that, he added, I never thought you were black. I just took you to be another human being. I could not bear it any longer, and I left my session. Very powerful picture, isn't it? Of a boy molested by the police, needing to be taken in like a human being that the therapist claimed he saw the patient as. But look at what he does. He makes a clumsy, cack-handed interpretation that essentially today would say gaslights the patient. He's got a problem in his own head with being fearing that his patient hates him because he's white like the police. He's got a problem, we could say, and he dumps it straight into the patient. And that, it's not surprising then that the therapy breaks down. Now, I don't know whether today you see that kind of account, but that sort of story that Jaffa wrote up there was pretty typical of what came through the door at Nafsiyat in those days, where one could see immediately that the problem with race and racism lay not with the patient, but with the therapist. Something was going on in the therapist that then gets projected onto the patient. Yeah. Now, in my paper that I presented at the seminar, I had said something like what I said to you, that I felt my patient had an unconscious problem uh, with racism. Consciously, she was cool, as they say, but unconsciously, there was something the matter. I felt that in my countertransference, I would say today. Couldn't quite put my finger on it. David Taylor, the consultant from the Tavistock, was asked to do a discussion from Lennox did a discussant's contribution to that paper and Sue Davison's, as well as David Taylor. David Taylor said, from the point of view of the psychology of the individual, I would regard racism as a subspecies of a narcissistic or paranoid disorder. Now, if you think about that, sounds like an ordinary kind of statement. It's a complete, if you bear in mind that at that point, 1988, psychoanalysis had a very clear set of understandings of narcissism and a very clear set of understandings of paranoid disorder. So that notion that racism is a subspecies of narcissistic problems or paranoid problems is a way of saying that it doesn't exist in its own right. That's what I got from David Taylor's position. Now, I've summarized it hopelessly, but I hope you get the point. So, when we talked about these sorts of things, we realized there's a problem with the mainstream of our profession. They just do not take racism seriously. Jaffer was very, very keen always to not turn Nafsiyat into a satellite clinic, a specialist thing somewhere on the margins to which the mainstream could send their difficulties with dealing with race. So for him, the educational element was always very important, and he was very keen that these problems should land back in the mainstream and that the mainstream should develop the tools to acknowledge it and so on. Now, I'm going to give you another clinical example of this problem. And this is from the paper that Jaffa gave at the Tavistock, Nafsiyat, and UCL seminars. His paper, some of you may know it, it's called Outside In, Inside Out: Some Considerations in Intercultural Psychotherapy. Now, in that paper, he describes how deeply disturbing it can be for a person from a third world background to encounter a native European clinician. Jafar, at that time a young clinical psychologist of Indian descent, as you know, based here in England, had traveled to Vienna to work and gain experience in psychoanalytic type work. He became depressed and consulted a woman psychoanalyst. In the fifth session, Jafar brings a short dream. And I quote it: "It's during the uprising against the British in India. He, Jafar, is on a march with his fellow students when they're confronted by a massive policeman with red turbans. Suddenly, shots erupt, and the friend next to him is shot and lies bleeding on the ground. Meantime, the police drag Jafar away to a waiting black van. He associates the red turbans of the police with the analyst's red scarf." This is how the analyst responds. At first, she reprimands him for going on a march. Jafar writes, "Didn't your parents tell you not to take part in such things?" Eventually, she interprets that the British authorities, whom he and his friends are in rebellion against, stand for the father he lost within a month of his birth. Jafar protests that though indeed he'd lost his father and had no memory of him at all, he did have a number of uncles who seemed to him to have been good enough surrogate fathers to him. That's the father figures he grew up with. And then Jafar goes on to insist on the transference link. In the dream, the analyst was behind the police in a vague sort of way, a reference to his associating their turbans with her red scarf. Now she interprets that he holds all Europeans responsible for his oppression in a way that underlies the irrationality of such a view. I quote what Jaffa says: "Maybe you think we all shot your friend," and suggests that he wishes to take revenge on her for this. Now, following that, Jaffa terminated the treatment. And I want to draw your attention to the similarity between this story and what I said was the therapist of Jaffar's patient gaslighting him, accusing the patient of being racist. Yeah. Now I say that is the analyst projecting their own racism, not owning it, not being able to deal with it, and therefore projecting it wholesale into their patient. Same mechanisms you can see. Now, how can we understand what went wrong? The analyst's interpretation of the dream is based on the understanding that Jaffar's depression connects with unconscious aggression against an unavailable object. That's Freud's argument in Mourning and Melancholia. It's what everybody knows, that's what mourning's about. I think, however, that that idea, not an unreasonable idea, is used to defend against even greater anxieties related to their ethnic cultural difference that was alive between them in the here and now. Let me tell you why I think that. In the initial interview, despite the fact that Jaffa was a psychologist who traveled to Vienna specifically to gain experience of psychoanalysis. Imagine somebody comes to you with that background. She explicitly called into question whether he was aware that psychotherapy is a sophisticated undertaking based on complex psychoanalytic theory and was lengthy and costly. Can you imagine? Somebody's gone to Freud's headquarters, so to speak. He's gone a long way to go there to get experience of this. And an analyst asks him that kind of patronizing rubbish. And on top of it, at the end of the interview, she checks with him whether he knew how to use a telephone. Remember, he'd been living in England, and India was not exactly a jungle by that time. Did he know how to use a telephone? Because she said the telephone is a Western thing. Today, you and I will realize, this is now about 40, 50 years after the event, easily recognize that the analyst was stereotyping her Indian patient and in the process reducing a depressed younger colleague to a miserable, backward, uncivilized foreigner. The patient clearly experienced this racial assault acutely, and we could see the aggression in the dream as, a, as an expression of that. The dream has the analyst with the red scarf killing, shooting at Jafar and his colleagues. That's the murderousness that I think that dream refers to. In other words, it is not, as the analyst thought, aggression directed towards an unavailable object, but towards one who failed him. Rather than see him as he is, she saw him through a racially stereotyped lens. So, therefore, the anxiety alive at the time the dream was interpreted involved Jafar's experience of her as a European racist. I flag up here that phenomenon is what I became interested in when I began to look into the internal racism. How come perfectly reasonable analysts who probably are decent, self respecting people, nonetheless can come out with this kind of thing when the going is tough? That's an important question that lies behind into the what racism inside the mind looks like. But let's return to Jafar's account to take our discussion forward. After breaking off with his first woman analyst, he proceeded to a second, to whom he related the same dream. That analyst put into words Jafar's hatred of European oppressors, based on the association between the red of the analyst's scarf and the police turbans, saying that it is something whose full meaning at the beginning of a treatment is yet unknown. Yeah, correct. See, a whole different attitude that opens it up. He went on to add that his patient was now in Austria, which had a history of collaboration with the Nazis. Whose side had he, the analyst, been on? This acknowledgement, this acknowledges that the problem was not confined to India, as in the dream, but here in Europe too. A regime was in place built on the idea of the superiority of the Aryans, which murderously targeted Jews, and as you all know, whose Oriental origin was seen as polluting the landscape. In addition, he acknowledges explicitly that the question of where he stood on these matters was relevant between the two of them, him and his young prospective Indian patient. Question is, was he too behind the police in some kind of way? And it's only after all of that is said between him and Jafar that he says a great deal is not known about them, and that raises the question of whether they could work together to explore it. Now you can see that strikes a completely different note to the first clinician. That brings in the fact that the analyst is also someone with something to answer about racial matters. He owns it, and he makes it something that is relevant between the two of them, that he should own it. Whereas you can see the first clinicians completely blind to it. And it's that blindness that gives her interventions that ham fisted and clumsy feel, even though they are derived from plausible psychoanalytic hypotheses. So I wanted to draw your attention to all of that because you can see how beautifully Jaffa brings these things alive. You can see how he knows that you can't hide your blackness, your ethnic identity, if you enter into the world of intercultural therapy. And you're going to have to share that. It has to be in the open. And if you're going to share it, it means that you yourself have to work on these things in your own mind. And that's the message, I think, that he gives through bringing that example of his own. And he's got good examples in his chapters and his writing of just what he saw. I mean, he worked full time at Nafsiyat, and all of us who dabbled in working there began to see that race and racism is really a very important element in the experience of the minority group patient. And if you weren't equipped to think about that, you wouldn't be able to make progress because you compound the person's experience by racism by dumping your racism in them, as the first analyst did to Jafar, and as the first therapist of John did to him on that very day that he had established trust and needed his therapist to put an arm around him. Yeah, that's clear to us reading Jafar's account. But the analyst's hang up about race meant that he failed his patient in those two ways, couldn't do what was required, and instead projected his racism out. Now you can see that I'm also making another very, very important thing, and I'll read it. I read it to you from Lennox's discussion of my colleague Sue Davison's paper. This is what Lennox says at the beginning. The opening comment in Sue's paper about psychotherapists having a constant worry about blind spots was something I felt I could say yes to on first reading. On second and third reading, however, I could not say yes. Overall, I fear too many psychotherapists are drunk with the satisfaction of knowing the code to and having access to the inner world to want to acknowledge blind spots. It's a very economical, condensed statement, but you see what Lennox is saying there. What he's saying is this: if you were to talk to that first analyst of Jafar's, she would say to you, there is lots of blind spots here, but she would have no clue that the real blind spot that required attention was something that she didn't understand the first thing about, that she didn't know the code to. Now, all of us, I suppose, will know what Lennox is talking about there, and he goes back on to unpack that in his discussion of Sue's paper. Essentially, he's saying The real blind spot concerns racism, and the mainstream clinician will change the subject. So instead of talking of the racism that's alive in the room, they will talk about the patient's hatred or ambivalence in relation to mother or father. That's what he means. That's what they have a code to, but it's in the service of not taking the racism seriously in a way that can allow for it to be opened up and so on. Okay. Okay, so far, Bafu. Are we all
Going
right?
very well. We're
And
very
so,
much all right. Yes.
so, so, so let me now say my path diverged from Nafsiyat after a while because I realized that in order to understand how racism works in the mind, one couldn't build on existing psychoanalytic theory. You had to start from the beginning with observations so that you could get to the stuff that wasn't being talked about. And I thought I am lucky in that sense. Many of the patients who came to me, not all, of course, many were white patients. So I thought to myself, we have a racial difference here in the consulting room. If I do something different to what the mainstream does, that is, if I become curious about what is not known about race, what can I find out? That was my attitude. So I waited because, as you know, people don't come to analysis or therapy for their racism. They come for whatever their inner problems are. So you've got to wait until the race issue comes up. And I waited and waited until things began to come up in a way that allowed me to look at what I was wanting to understand is not how does this person relate to me as a person, not how does this person relate to me as a woman to a man or a man to a man. I wanted to know how does this person relate to me as a white person to a black person, or some patients saw me accurately. I'm from a Muslim background, as Jaffa was. Um, you know, so some people would see me as black, and some people would see me as Muslim, and then of course they would be in a Christian kind of thing. So when I came across that, that's what I became interested in, and I summarize for you what I found. I found something very different to what everybody else says is involved in racism. Do you remember? I say, others say it reduces to the stuff we know already. I say it occupies a completely different space in the mind. So let me give you just, I'll give you an overview of how to think about it. If you think, what does what is the task that psychoanalytic theory sets itself? The task is this, is to give an account of how a helpless baby who doesn't know nothing about nothing is totally dependent on others in order to bring it into the world, how that person comes to be a fully functioning human being who will identify on a gender distinction. You know, I am a man and not a woman. I'm homosexual and not heterosexual. I'm, all about the gender thing. How does that happen? And then you'll know, that's Freud's theory of the Oedipus complex, where he says at about 4 or 5, the child encounters a crisis, comes in saying to you and me, yes, I'm a little boy, but it hasn't figured out what that means. When it's done with the Oedipus story, it's worked it all out that a little boy is going to become a man like daddy. and not a woman like mummy, and so on. So that's the big where Freud began, where he said, okay, we can understand this very important thing, and it's a theory that's validated and discussed, and its cross-cultural ramifications gone into very it's rich body of theory. And then they worked out that actually there's something that comes before that. That Freud was wrong to put such emphasis on the Oedipus, because before that you've got to become a person first. First you've got to emerge from what Freud thought was a merged kind of relationship with your mother, where you and the mother are one. And you've got to sort of get yourself out of that so that I am an I and not a you. So that's what David Taylor means by the narcissistic disorders. They are the so if all of us, by definition, because we can sit here as human beings and know who we are, we've done that. If we can't can't sort that out, then if we haven't negotiated that, if we haven't got that developmental step in place in our minds, then we will end up with serious mental difficulties. So you'd end up in the old days when they had mental hospitals where they locked people up. That's where you'd end up because you don't have the equipment to say, I am a stable me, and therefore I can step out of the front door and go into the world. Now, psychoanalysts think if you've got account for those two things, then you have accounted for how we become members of a social world. Yeah, you can see how that would work. But they forgot something. They forgot something very, very important. That if you look at each one of us, we are not just eyes in relation to others. We are not just somebody on the gender divide thing. We are also members of in groups and not out groups. So if you look at me, you can look at my skin color and what I've said to you, you can place me. I am the member of, if you look on the color thing, I'm part of the persons of color. I identified myself since apartheid days, I am black. And that is in relation to white. That's where I came from. When I found myself in this world of in and out groups, it was within a racist structure externally, where some were on one side and others were on the other side. Yeah. And if you look inside, you will find a definition of me as one and not the other. That is how our in group identity is internalized. And that's something that psychoanalysts have completely overlooked. So it's not part of the story of socialization. And that's why there is no theory that can account for the experience of racism. Yeah. So if you follow my logic, I say that you cannot become human unless you become a member of an in group. That happens usually around the time of the Oedipus complex. It's about four-ish, 3, 4. So I remember when my my oldest son was at that sort of age. He became preoccupied. We couldn't figure it out. He became preoccupied with what did he call it? The Indian shops where we bought our meat, say, because it's halal meat. And the Indian shops sell spices. So they have a very distinctive spices smell. And he worked out a categorization about, I forget now, it's such so long ago. He had a word for a very charming word, because he knew these things were to do with spices. It's those are the 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 that's what he called them. He called them the Urdu shops. You know, Urdu, the language Urdu, which my mother-in-law and all of them spoke. They are the Urdu shops. And, you know, he was three, so not a lot, but he absolutely down to, and he could, what he meant, that was the shop where the Muslims go, and it was different to Sainsbury's and Tesco's and stuff where we also go. And you realize this guy was trying to figure something out in his mind. You saw a categorization of us, them. That's how it comes to be inside the mind, right? Now, how does it get value attached to it? Because that's just, you know, yeah, it's a spice shop and a Sainsbury's shop. You know, why? Why does spice shop become, as it will be, why does spice shop become an inferior shop? And for that, you've got to look into the world itself, where today, if you look at it, you'll realize that the world, our world, continues to be marked by the definitions brought in under the colonial system. Yeah? So our world is a post-colonial world. It's marked by those divisions. And the best person to read for that, I'm sure you know, is Frantz Fanon, where he just has a way of talking about this stuff with passion, with feeling, with pain, that makes you realize how these categories exist. Now, I don't know if you remember in Black Skin, White Masks, Frantz Fanon talks about something he calls the black problem. And he says, I have to acknowledge that for the black person, there is only one destiny, and that is white. A powerful, controversial statement, but it's a psychic truth he's saying there. And let me give you a quick example as to what he's talking about. It's most, for those of us who are black, it's one of the most disturbing and painful things to acknowledge. Yeah. But that is to say that the world out there is a white world. And if we want to be self respecting, it is only natural that we would take on the white things. Do you see? So that my son, when he was 3, he was mapping out stuff that he didn't yet know that one day he will turn his back on the Urdu culture and turn towards the white culture. When would that be? That would be when he goes to school and when he realizes that he's learning English, and that to know English and to be able to speak English and to deal in English, that is the way forward. You have no choice. That's what Frantz Fanon means by the black problem. That is something that's deposited in us as a consequence of the fact that this is the world that we live in. It's a post-colonial world. In other words, the world is marked by racism, anti-dark skinned people racism. That's what the world is marked by. And like it or not, we will end up internalizing that. And there you then have an internal racism. Do you see what I'm saying? Where the Urdu and Sainsbury's thing that got put in place gets valued attached to it, and you unconsciously identify with white. And Fanon's whole work is to say to us, look, if we want to be free, we have to acknowledge that. We have to know that. And we can know it and we can do something about it. Yeah? You can see it's a straightforward psychoanalytic thing. You know what's going inside of you, and that gives you freedom. Now, what's the problem with our white core for us? Frantz Fanon, if you read him, and if you take him seriously, he saves you. He shows you what you have to do. He acknowledges the pain of how you've identified against yourself. and he shows you through the way he struggles with it that there is a way to free yourself, and it's not rocket science. Now, what's the problem for our mainstream white uh, therapists? For the white person, they are not written by culture into the inferior position. Like it or not, just as we are written into an inferior position if you're black, if you're on the other side, you are on the white position, which means that you are opposed to the black, your racial other. Okay, so that's part of that whole difficulty. And that's why it is so difficult for white people to acknowledge that. It's easier for black people because we have ancestors. Franz Fanon wasn't the first, but his books are still in print. People read him. People can't put it down. People are disturbed by it. He helps us to deal with our race problem. White people don't have that. And so they feel accused. You can see. So if you look at Jaffa's patient John, there's nothing racial in his material. He has been assaulted on the basis of race by somebody else, the police. In his mind, there's nothing. His therapist is his therapist, whom he turns for. Why should the white therapist speak about racism? Simple answer, because he feels unconsciously accused that because he doesn't get assaulted in that way by the police, he feels unconsciously accused that he's on their side. You see? So that's the unconscious racism that our profession suffers from. Now, if only people can acknowledge it and know about it, then you could talk about it. The trouble is, you feel accused in such a terrible way that you put layers and layers of defense on top of it. Yeah. Now, in other words, have developed in my book, I talk about it in more detail, but that defensiveness, I think, needs to be understood because it's different from the sort of usual things that people talk about. I think I have probably chucked a lot at you, so I think I had better stop there and deal with whatever else we can through discussion. Is that okay?
Thank you, Fakri. That is a journey that you've taken us on, really thought provoking, rich and insightful, and there's so much to ponder on and to take away, and we'll see what comes out uh, uh, in the space this evening. So thank you. The floor is now open, and as Fakri said, it's an invitation to everyone here to share your thoughts, reactions connected to what we've all heard and what that's evoked for us, and a chance to build on the conversation. And there might also be comments and questions in chat as well, which our colleague Lizzie would feed through. The floor is
Yeah,
open.
yeah. If people could raise their hand, if they'd like to speak, and we can sort of organize it that way. Yeah. And maybe we could start with the question in the chat, Bakri. So Seema was asking, could you say something about unconscious racist attacks against the therapist of color from white clients, and possible examples of what this might look like and how to work with this in the room?
Sorry, unconscious. I can't see the chat. Where do I see it?
So at the top, there's the panel with all the icons.
Yeah.
There's
Okay.
to the was yeah,
I see.
yeah,
I see.
yeah, yeah.
Yeah. You're talking about unconscious racist attacks. I mean, sometimes, of course, there are conscious racist attacks, and we have to deal with that. But by unconscious racist attacks, you've, I mean, we know it, don't we, as the sort of thing that happened to Jafar. Remember when he talks about his analyst patronizing him, you know, not not talking to him like an ordinary human being. That's how you pick it up in the therapy setting. In other words, we all know what it's like when somebody respects you as another person. When there's something racist going on, the dynamics are basically these, that the person looks at you and strips away your humanity. Yeah, your wholeness, your sense of wholeness, it is stripped away, it's attacked. And instead, what they do is they pour something into you, which then feels within the room like something alien pushed inside of you. And therefore, you can't move. Your ordinary, way of just being yourself, maneuvering your way through around a room, through ideas and so on, that is interfered with. So, in other words, it always involves the person splitting off something of themselves and forcibly pushing it into you. And the and with unconscious racism, it is usually the object, which in that therapy setting is you, the therapist. You will feel it, you will experience it. Yeah? So the first thing and most important thing is to notice that. Yeah? And once you've noticed it, then you have to gather your courage to try and understand, to describe what's going on between you. But that's how examples of how this might look like and how to work it with it in the room. So that's how it would look like. It would you would feel it, that this person's looking at me not as my regular self. This person's pushing their view of who and what I am onto me. So, in other words, we call that feeling the impact of a powerful projection. Yeah? And how do you deal with that? My view of it is the first thing is to realize you're dealing with something quite serious. It's not something quick that you're going to be able to get out of the way. This is going to be something that will have to be unpacked slowly. Yeah? Secondly, before you can talk about it properly, you have to have some hypothesis as to what it is that has been put into you. And that you can usually begin by exploring. You can say to a patient, I have the impression that you talk to me as if I know that, or as if I should know that, or if I don't know that. Do you see? So I would go first for a description of how this interchange looks like in the consulting room from my perspective. And often patients will disagree with you, and then you've got the basis of a discussion where you can see, can you talk about it? Somebody mentions microaggressions, that I would normally take up straight away. I said this to you, and you said that to me. Whatever you think the microaggression is. Um, So that usually is something that's sort of, person's patronizing you. The person looks down on you. And I think my view of it is name it. If you can name it, If you think you know what's going on, name it. Gather the courage and try and if the patient takes umbrage, they take umbrage. And your view is, well, I'm only observing what I think is there. I could be wrong. Yeah. So I try to, in other words, I try to normalize it, if you see what I mean. Deal with it in a normal, regular way. Because that's what psychotherapy is about. I'm so sorry I'm not in the room with you because I can't get a sense of on Zoom and these things, you can't get a sense of where everybody's at. You can have a conversation, so we'll have to try and work around them.
You can see the other questions, Fakri.
Just back again, what it looks like in the room. The patient I write about in the book. You laugh when you hear this. So this is a patient, a very good patient, right? He comes and the person who refers him tells me this man is very, very disturbed. He's tried everything and so on. So he sits in my consulting room and he talks to me as if he's a gentleman. It's my fantasy, right? This is an English gentleman sitting and talking to me. And I start thinking to myself, well, how does that link up with a guy who's supposed to be very disturbed? And then I think to myself, oh, I see. He's come to see not come to see somebody who apparently can deal with very disturbed people. So, do you see, it's the observation of what I see. The man's very nicely put together like a gentleman rather than a man with problems. And that he is patronizing me by not seeing me as somebody capable of dealing with disturbance. That's how I picked it up. And in those days, I knew nothing about these mechanisms at all. So I thought to myself, well, what am I going to do? I can't sit here and not say anything about it. It's such an obvious thing to me, you know. And he goes on more and more and more and more, being this great English gent. Um, so eventually I said something about that. And then he came back with something very, very powerful and explosive. Yeah. And I was pleased because at least we weren't two gentlemen anymore. If you think a patient's got serious problems, at least when something's exploding in a consulting room, you think, well, now we've got problems in the room. And then we've got a chance of trying to understand it. So it's that sort of thing, you know, observing closely your feeling about the way a patient treats you and having the courage to talk about it with the patient, you know, bearing in mind that this may cause trouble. No. Is that something you can relate to, what I've just said? Or is it too abstract? Because sometimes one person's experience doesn't link so easily with other people. So you must help me out there.
It's really helpful, Fakri. Yes, particularly when you talk about, I think you've said that on 2 or 3 occasions, gathering courage.
Um, Somebody asks, they'd like to hear what I think about waiting for the issue of race to come. I think it is true that on the whole, we do want the issue to come from the patient rather than to be brought by us. I don't think we have a right to bring things because we're interested in them. I don't think that's right. I think we're open to the patient. But but let me say something very, very important. What comes from the patient is what the patient is consciously aware of, what the patient says to us in words. It's what the patient conveys to us without words. It's the way the patient is with us. For instance, a person may be very uncomfortable with us, or a patient may feel overly comfortable with us, or something like that. And all of those things, observations like that, I think we are within our right to observe and to consider maybe that is what the patient is bringing. So it's what the patient is bringing unconsciously, not through conscious verbal discourse only. So I tend to, because you can't, nobody's a nobody's God and can tell you what's unconscious in somebody. We're making a guess, and so when I think something's there, but it's not in consciousness. Consciousness is easy because it's there in black and white, so to speak. If you think it's there through feeling unconscious, I tend to observe it a little bit more, and I tend to try and talk about it without necessarily saying anything about it, if you see what I mean. If to mention it, to bring it into consciousness and so on. So that's quite important to to not to avoid it, and at the same time to let it come from the patient. And you can interact with the patient, of course, in order to bring things out. So that's the waiting for the issue to raise to come up. I don't wait long. If in the first interview I think it's there, then I would say so. I have a feeling that you're very uncomfortable being with me, and maybe it's because I'm black, or maybe it's because I'm a man, for example, if you have a woman patient, or maybe it's because I'm old, if you have a young patient, you know. Um, so I tend to try and put things like that, but those are explorations. It's just I have an impression. I think this is what it's about, and if the patient says, "Don't know where you got that from," then of course we take seriously. We may be wrong. We have to take that seriously always, or that the patient may be defended. That's what's interesting about our work. It's not so often, it's not black and white, clear cut. You got to keep things open. So that's how I get the therapy thing.
Fakri,
Yeah.
there's a hand up here. Someone would like to ask a question. Derry, your mic is muted, Derry. Derry, your mic is muted. No, we still
Oh,
can't hear you. Unmute your mic.
he can't.
He can't. Oh dear.
Maybe it's in the system that needs to be done.
Lizzie, is there something in the system?
Lizzie?
Oh dear.
Derry, if you go to the top of your screen, you should see several icons. Can you see the leave button that's in red? Don't click it. Yeah, so you can see that. Two icons to the left, there is a little microphone sign and it says mic underneath it. Oh yeah, I think
Okay,
you've got it. Yeah.
I've got it. Hello. That was frustrating. Yeah, I have to remember what I was going to say now, which is, as a white therapist, working with a black patient, one of the things that I notice a lot, and I become, I suppose the word is suspicious or cautious about racism being alive in the room, is when there's when somebody is being such a good patient that somehow everything I say seems to have value, and they it isn't that that what they say doesn't, but it there's a sense that I get of I'm being deferred to, if you like. That's maybe a way of saying it, and it reminds me of it's a feeling I get really, and I've had it fairly often, which then makes me wonder: is it my feeling? Is it their feeling? But I often I raise it in the room with them. But it seems to me as though they're deferring to me and not telling me what they really think, because it kind of conflicts with something that I might be offering them or whatever. It makes me think sometimes of Lennox's proxy self um, presentation, you know, where somebody is trying to work out what kind of white therapist you are. What I was just interested in your comment about that. It does seem to happen a lot.
You see, you have to. There are two things you have to do. You've got to look a bit at your own racism. You know, you have to ask yourself. I didn't get to say this, but part of my model of internal racism is that you cannot help it. If you grow up in our world, this is a post-colonial world, you cannot but internalize racism. So it is in you whether you like it or not, you know. And the first, for us therapists, the first job is to get to know our racism. And it's not so easy, you know, because racism we tend to project. You know, I used to be an expert on Margaret Thatcher's racism for many years until I realized that's not helping me. You know, where's mine? And if you get to know yours, you know, you do it privately. If you get to know your racism, you know, I tell you, it's not an easy thing. You know, you will feel bad inside yourself because you realize in your mind you do things that you don't approve of, you know, to other people. You know, if you look beneath the surface, as my wife was talking about the other day, she was saying, you know, she realizes that when she sees a group of young black men, she gets very frightened. She doesn't do anything, but she gets frightened, you know. And she realized, hang on a minute, you know, this is racism. I have, I've put something into them, you know, and then of course it's easy, not easy, but at least you know what you have to do. You know, you've got to know it. You've got to see how bad is it, you know, and you can't answer those questions. So you have to ask your unconscious, you know, and your unconscious, if you ask nicely, it will give you a dream. And sometimes those dreams are very disturbing. But these things we can listen to, isn't it? That's what we do as psychotherapists. It's a job, you know, to be in tune with our internal world. And I find the more we can do that ourselves, much easier then to be receptive to these things when a patient comes. Yeah, because then if you feel that, for example, the patient's looking at you as a white master and that they're a black servant, you know, you could possibly say that to them.
Mm.
It's not impossible to say these things to people. I think I'm being looked at because you're on very good grounds there.
Yeah, I think
Psychotherapy
it's
doesn't.
really that's really interesting because it's in I guess the acknowledging my own racism and being aware of that, and then noticing that kind of
Yeah,
deference in the room. It's actually sometimes it seems to be about staying with it and making sure
that's
that
right.
is this your stuff or is this their their projection that you're getting.
Exactly.
And that takes time maybe to sit with.
But you see, it can be done. We'll feel awful about ourselves seeing some of these things, but you know what? You haven't killed anyone.
No,
You know,
yeah,
we're just terrible bigots in some bits of our mind, and if we are, it's better to know that.
yes, absolutely.
Because if you don't know it, you do what those therapists do. They
Mm,
they project it onto their patients. So that's the first thing. If you do your internal work, you are less likely to project it. And then you'd be more freer to talk about it. I hate being idealized. Yeah, you can understand that. I
yeah,
come from South Africa. If you idealization is always to do with, putting the white thing and
mm,
I hate it. So when a patient does it to me, I hate it.
mm,
And it tends to be one of the things I observe. I often say to my patients, you talk to me as if I'm some kind of guru, some kind of saint,
yeah,
some sort of God that knows everything.
mm,
Whereas I'm only doing my best. I listen to you, I do my best to listen and hear and to attend and, that sort of stuff. That's all I'm doing, you
yes.
know.
I think that I mean, in a
I just
way,
have to say this,
sorry,
that we're running out of time.
okay,
We're
thank
getting
you.
really close to the end of our time this evening. And I'm not quite sure how teams work, that it might just get rid
It,
of us.
I think
Would it?
no, it won't get rid of us. We are okay to run over a bit, but yeah, I think it's probably good to keep it concise because we do have another question, and a few more comments in the chat.
So we'll just move it to perhaps 5 past and draw things to a close.
Yeah, we
Yeah,
started late, didn't we?
Yeah.
yeah. So
So
yeah, we have another. Thanks, Derry. We have a question from Sabia.
Hello.
Hey.
Thank you for the
Fine.
wonderful talk. I'm not a therapist. Therapist in a way that I work with disabilities, people with autism and learning disabilities. So I just want to share one of my experience, which I have one of a client who has mild autism, and she's a teenager who once in the session she shared that she wants to learn British accent because she wants to get accepted in school with her friends because apparently she had changed school and she wanted to get feel more accepted. So in the session, I basically explored that in a way that how getting the British accent will help her make more friends. Of course, I could not go really a lot deeper because she did not have the capacity to go too much in depth. So I have my supervisor. She is white. I won't go into black and white, but I kind of, it was very interesting her reaction because when I shared with her the gist of the session and what came up. So her reaction was quite, in a way, towards me, that as if that I should not have handled my client by telling her, by acknowledging that, okay, she wants to learn British accent and that will help her get accepted in school. What she said was that you should have told her that she should. So my client is a black British. So she basically was a refugee. She came to Britain at a very young age. So my supervisor was like, you should have told her to embrace her accent, her African, wherever she came from Africa. That is her accent. Why did you tell her? Why did you not emphasize that she should accept it and love her origins rather than replacing it with the British accent? And I could see that she was quite, her reaction was very strong. And then she went on with it. I feel really offended that why didn't you just tell this to your client, that why is she replacing her original accent with a British accent? So what I felt was that I understand that her intention was quite in a way good, but what she I felt failed to see that this client of mine, the reason she wanted to uh, understand British accent and learn it was just because that she was getting rejected, um, fairly because she doesn't have that accent. So this, I felt that my supervisor was quite, in a way, unconsciously blind towards this, this thing which usually people of color face with, that if they don't sound British enough or have an accent, they do struggle getting accepted. And then it comes to again the language and how much you have command over English language and your native language. So it all then comes up with all that. So just wanted to share my this recent my experience which I had with my client.
It's very interesting, isn't it? It's interesting and complicated because, on the one hand, why shouldn't one do what one wants to do? If you want to sound more white, if you want to put it like that, why shouldn't you? And uh, my I have a problem because you can see, I think in terms of a practitioner. I think like if somebody were here sitting in that chair over there, how would I get busy with this? What would I open up? And I'd want to open up all sorts of things, you know, and including what your supervisor says. I might want to discuss with the patient. There's an assumption that Africanness and African accents is rubbish. Where'd you get that from? I wouldn't say it like that to the patient, but you see, I want to open up. Where do you get that from? And then your patient can come back to you and say, yeah, you're right. Maybe it's true. I don't like the way my mother sounds or whatever it is. And then you can say, well, your just because your mother happens to have that accent, maybe you just hate her because she's your mother, you know. And why does the accent have to come into it? But you see, the emphasis would be to get these things into what you can talk about, because then you can disentangle the different strands of meaning.
Mm,
Because there is a way in which, when somebody says, look, I want to speak like a British person, they are also talking about their wish to be seen as ordinary and successful and not hampered by something or other. We got to have broad minds. We've got to make room for that. I can understand that. I mean, I understand it because I realized long after that, when I began to read Fanon, that I do exactly the same. I'm such a traitor. I go to a white university, and this is in South Africa, and within 6 months, I'm sounding like these guys, rather than the guys back home. And I didn't even realize it. And then you read Fanon, and he says, "Listen, pal, you're just trying to be white. What's your problem?" You know, Now, you see, if we can turn these instead of accusations and into persecutions, but into these are the difficulties we end up with because we live in this kind of racist world. And you and I are not going to be able to sort that out. It's so deeply embedded in the world,
mm,
you know. So I think if you use that as your yardstick, that you want to open things up a bit, I would do what your supervisor says. When somebody is identified against their group, I do try and get it in there that,
mm,
you know, there's nothing wrong with an African accent. What's wrong? What's your matter with you? You know, but not imposing it on the patient or not. We are not into that. We want to bring things into discussion because the more you can, you give people choice. And somebody could, for instance, it's perfectly possible to say, look, I have no choice but to learn to speak a bit more like that because it really will make life easier for me, but I must be careful that I don't become racist towards my own culture and my own.
Yeah.
That's not a bad thing to learn, and that can come from these, if you can open it up so one thinks about it, then I think that's that's something that you can do, whatever your practice. Your practice is different from mine. I
Yes.
get, but whatever, because it's the responsibility of the professionals, isn't it? You are in a different position. You've got to do something that you think will make things easier for your patient, and help them, you know, to get the good they want without feeling they've also bought a whole lot of racist rubbish, you
Yeah.
know. And
Sorry,
that
sorry, I'm mindful of the time. Just a short, just short comment was that this, my talking about my supervisor. It was not about what she said, which was wrong. What she said was actually absolutely correct. I mean, right in a way that that's what eventually I would have gone in the same way. But her inability to capture
yeah,
my client's need
yes, and the
and
complex,
acknowledge and respect it
yeah,
that she has that need, rather than judging it that why she has that need. So that was something which I felt was that she was judging the need of that client rather than acknowledging that she will have this need. One, because she lives in a society which is different from hers, and then she's a teenager who wants to get accepted. So yeah, just wanted to comment on that. But thank you for your input.
that is such an important point, though, because in this area, it very quickly becomes concretized like that.
Mm.
Where we human beings are complicated creatures. We've got all sorts of complex and conflicting wishes and desires and so on. We want to be acknowledged as that. I think we need to. That's what we want to do. But notice in this area, it becomes very quickly prescriptive. It's only one way, and that's to do with this territory in the mind. Because as you know, race is black and white. It's always a binary. So complex reality gets reduced to binaries.
Mm.
So you're either this or that. And if you smell that, try and be sensitive to it and say to yourself, let's bring complexity back. Yeah. And let's see if we can appreciate, like your patient, I understand. She wants to succeed. And can we get her to understand you don't have to be racist against your African self in order to succeed? If you can move it on to that, then you've really helped her.
Yeah,
And now she wants to succeed and not shoot herself in the foot.
absolutely.
Mm.
Yes. Thank you.
Thank you, thank you, thank you. Fakri, you've given us so much. Really grateful in the way that you've brought history into the frontiers of your work. And in chat, there are lots of comments being left there
Mhm.
about
Sadly,
how appreciative people have been listening to all that you've had uh, to offer us to reflect on. And I think we could sit here for another hour or even more. Yes, reflecting. But it's really left to me to thank you for giving us this time and opening up the space in such a very, very rich way. There have been people on the call from decades, people who were around um, during the times that you were reflecting on Jaffa's time, who also commenting about how very helpful this time has been this evening. So thank you again, Fakri, and thank you to everybody here who have shared the comments, questions, and reflections, and added depth to our conversation. We look forward to continuing this valuable discussion at next year's memorial lecture, where we're looking to explore Lennox Thomas's work. So we'll be interpreting Lennox Thomas next year. But do please stay connected with Nafsiyat via LinkedIn, via your donations, via Instagram and Facebook. And do continue to support this really important work. I mean, you've heard much of what Fakri has to say. There's so much significance in this area of work that we're positioned and delivering.